Hey everyone! So I'm Sage Akuri and welcome to my YouTube channel. So I wanted to make a quick YouTube video to explain the process I went through to get my top surgery and yeah, basically the steps that I took and during surgery and post-op. So the first step in Melbourne to get top surgery is to see a GP. After seeing a GP, you get a referral from them to go see a psychologist. Now you can't just see any psychologist, you have to see someone who specialises in gender dysphoria, and usually you'd only see them for like 2 or 3 sessions. So you need the psychologist to medically approve you to get top surgery. This is just for them to check that you're a sound body and mind and able to make a decision for yourself. And yeah, so once you do that, then that referral gets on to your surgeon. Now you can see a surgeon way before you do any of this, but the surgeon will, if you don't have a referral from your GP to the surgeon, it will cost you out of pocket. Otherwise you can get some of it back on Medicare if you have a GP referral. What else? So you go see your surgeon and they'll do like an examination where they'll ask you to take your shirt off and examine your chest, take some photos and discuss with you what surgery options you have, and then from there you can basically book in a surgery date. Mine was about a couple months wait, but I was really fortunate that they had a cancellation pretty early on, so I didn't have to wait too long. Yeah, so after that I just basically went in his office, signed some papers and consented to have surgery. And then after that, just had to save up enough money. So Dr. Ives is who I use, he's my surgeon, and he practices out of Masada Hospital. Now Andy charges $4,500. Had to pay the anaesthesiast as well, which was $2,100. Masada Private takes $3,475. Now if you have a private health insurance, you wait 1 year because it's a pre-existing condition, then you can claim that $3,000 onto your hospital cover and you only have to pay your excess, so that saves you $3,475. Yeah, so all up it cost me just over $10,000, and that's, yeah, cool. So surgeon and anaesthesiast you have to pay before your surgery, and on the day of your surgery you pay the hospital the full charge or your excess. So basically when I got to the hospital, I wasn't really told too much of what to expect. So when I got there, the anaesthesiast came and had a consultation with me, and they kind of chatted to me about what they're going to be doing with anaesthesia, why it's required and what's going to happen after surgery and how I'll feel. And then after that, Andy Ives came back in to do a consultation as well, pre-op, and just chatted to me about what surgery is going to go down like, and just drew some lines on my chest, and then just waited patiently for the nurse to come take me in. Got into a gown and some cool red socks, and then went into the surgery and was out within a few hours, about 2.5 hours, and then yeah, came out, everything went pretty smoothly, and then it was just up to recovering and being out the next day. Unfortunately with my surgery I just had like a little problem with a hematoma, which is just like some blood clotting and some fluid building in the left side of my chest that wasn't coming out in the drains, and so basically just had to go in the next morning and have a second surgery to get rid of that, and everything went smoothly after that, and I got to go home within a few hours following the second surgery. So yeah, basically I'm in this chest garment compression thing here. It's like a little crop top there, and that's just holding everything really tightly together. It's kind of uncomfortable and a bit painful when I take it off, so it kind of feels a bit more safe when it's on. And through that I also have these little cool bags, and they're my drains that are attached, and I'll show you that in a bit. Yeah, and that's just draining all my liquid out from what's left in there after the surgery. Normally you'd get them removed after a couple of days, but because of my second surgery I have to wait now, so I think it's a 4 or 5 day wait, so I'm getting them out tomorrow. Yeah, and that's it. Basically that was the process. It's a month recovery now. I can't really lift anything, I can't do a lot with my arms, There's not a lot of movement, like I can move them up about there, but I can't really do much else with my arms. And so having a good support network around you while you're recovering is really, really important, really crucial, because you're going to need someone to help you out with a lot of things. Yeah, so basically now I'll just take my shirt off and show you guys what it all looks like, what we're left with. So, you know, view this at your own discretion. It's a little bit gory. You know, there's still stitches and coverings over the stitches, but it just looks a bit worse than what it actually is. Alright, here we go. Cool, so it looks a lot worse than what it is, and this here is covering my nipples at the moment. Some padding and like stitches just to help it heal before I can actually get rid of those, and same as here, it's just covering my stitches. So I hope that this benefits, you know, anyone who is gonna have top surgery or is thinking about it. Basically, like, I wasn't given a lot of information. Even when I got there, you know, it all happened quite fast. You know, I got there, I had the consultations, and then all of a sudden I was pulled into my surgery, and then I was just out of my surgery. And like, you know, 1 minute I had boobs and the next I didn't. Like, it just went so fast and it was just done, which was awesome as well. I can't stress enough how you have to have like a really good support network. You have to make sure that you're around people that are going to take care of you and look after you. Mentally as well, like, you need to be around people. It could be a very like kind of isolating thing that you do because it's very personal. You know, you're also cooped up for a few days at the start, not being able to really do much and walk around, so having someone to talk to and people around is a big help. You know, just remember that it's all part of your journey, the pain and the discomfort and whatnot. It's all part of it, and you know, it's all worth it in the end. And it's all temporary. You know, like the second you have a look at your chest right after your surgery, you already realise how worth it is. And you can just imagine how much better it's going to look once it's all healed up. So, you know, patience is key because it will take a little while for everything to heal. Yeah, it is an experience that I'm going through, and I really want to enjoy it because it's part of my journey and it's building who I am and who I want to be. So don't forget that, it's very important. So mostly, yeah, enjoy it and have fun with it. So subscribe to my YouTube channel if you want to keep seeing more of my videos. I really appreciate everyone's support and comments as well, for everyone watching this. You've all been pretty amazing. And thanks for watching my video.